For most people, just hearing these words trigger the same thought. It is immediate, automatic, almost impossible to stop. But here's the key thing. That first thought is often wrong.
Not because chest pain doesn't matter, it does, but because the chest is one of the most misunderstood parts of the body. Chest pain feels scary for a simple reason. We've been taught to see the chest as a single, fragile box. The heart lives there, the lungs live there, important things live there. The chest isn't one structure, it's a shared space. Muscles, nerves, breathing, digestion, and bones all sit crowded together in the same area. And when multiple systems overlap like that, signals can get confusing. That overlap is where most misunderstandings begin. So when something feels off, the brain doesn't pause to analyze. It jumps straight to the worst case explanation. That shortcut feels protective, but it skips something crucial. Take muscles, for example. One of the most common explanations. The chest wall moves constantly. Every breath, every shift in posture, every moment of tension. A tight or irritated muscle can create sharp, dull, or aching sensations that feel deep, even when they're not coming from inside the chest cavity at all. Then there are nerves, and nerves don't behave the way people expect. They don't report damage, they report signals, and sometimes those signals get amplified or misread, creating sensations that feel intense without any serious injury underneath. Another source people rarely connect to the chest is digestion. The upper digestive system sits directly beneath it, and irritation there, such as acid reflux, can travel upward and feel like burning, pressure, or discomfort in the chest itself. Same area, completely different source. And then there's the stress response, often overlooked but very real. Stress doesn't stay neatly in the mind. It shows up physically. Tightness, pressure, a sense of not quite being able to take a full breath, sometimes without any structural problem at all. Now, to be clear, serious causes of chest pain do exist. They're less common than everyday, benign causes, but they matter because missing them can be dangerous. And here's the part most people miss. When fear is involved, our brains are very bad at estimating likelihood. Location alone isn't enough to tell the story. A more useful way to think about warning signs isn't labels. Patterns. Chest sensations deserve urgent attention when they're new, sudden, severe, or clearly different from anything you felt before, especially when they come with other changes. Breathlessness, feeling faint, sudden sweating, or pain spreading to the arm, jaw, back, or upper stomach. That isn't about panic, it's about listening to context. So here's the reframe. Chest pain doesn't mean one thing. It means your body is sending a signal. Understanding that signal depends on the bigger picture, what it feels like, what else is happening, and what your overall risk looks like. When people grasp that difference, fear often loosens its grip. And if you've ever felt a symptom and wondered, why does my body do that? That curiosity is exactly what this space is for. Here, common symptoms are broken down calmly and clearly, without panic, without guesswork, and without brushing off things that genuinely need attention. So if curiosity tends to beat anxiety for you, this might be a good place to stay. And one last thing, if chest pain is sudden, severe, or comes with breathlessness, collapse, or pain spreading to the arm or jaw, that's an emergency, not something to watch and wait.